To other news here at home, a third person dying from the MPox virus in South Africa. The health department saying the number of laboratory confirmed cases also rising now to 16 so far. The infections have been found in KwaZulu-Natal, Gauteng and the Western Cape. The patients are all men aged between 23 and 43. Those travelling from MPox endemic countries have been urged to seek medical help if they experience symptoms which include a rash and a fever. Dr Jeremy Nel is an expert on infectious diseases, a specialist at Wits University. Dr Nel, good afternoon to you. This disease almost seems to be spreading. Are we now at the point where we need to be quite worried about how quickly it's spreading here in South Africa?
I think it's a story of two components. I think the risk to the general population still remains very, very low. At the moment, this is not COVID, thank goodness. This is a virus which has spread much less efficiently, much less infectiously. It's really spread predominantly and almost exclusively by close physical contact with another person who's got symptoms or is about to show symptoms. And it's really spread predominantly through sexual networks. We've identified about 16 cases so far. I'm sure there's many, many more that haven't stepped forward because obviously there's always going to be a bias towards finding the more severe cases. But it certainly isn't a widespread risk to the general population. It's rather a more focused risk to those at sort of a high-risk sexual behaviors, particularly within the MSM, so-called the men who have sex with men community, where it's predominant but not exclusive.
We learned during COVID how so many people could get a disease and only some would get severe cases and some would need to be hospitalized or have very severe symptoms. Why do some people get severe cases of MPox and others don't seem to?
Yeah, it's a really good question. So that number with MPox is probably well under, so it's about maybe 6-7% of people who need hospitalization and well under 1% who will die from it. So it's only a very small minority, as you rightly point out. The risk factors that we do know really include mostly immunosuppressive conditions. So the one we're worried about in South Africa clearly is HIV. So with HIV, uncontrolled HIV, so if you're not on your medicines or if you're on them but they're not working, that seems to be a risk factor for severe disease. Well-controlled HIV does not appear to be a risk factor. So if you're on your medicines and they're doing well, then there's no risk of severe disease over and above the risk to any other patient. Other immunosuppressive conditions can do the same, but really HIV is the dominant one, and to some degree pregnant women as well, although we haven't had, fortunately, many of that category so far.
Again, during COVID, we came to understand the different variants that coronaviruses have. This is obviously not a coronavirus. I want to call it a pox virus, but that's probably not the scientific term. I know it's related to the other poxes. What kind of variants or variations or types of MPox do you get?
Great question, and you're right. It is a pox virus. It's a big family of pox viruses. There's two main so-called clades. You can think of them as strains of MPox. The one which has spread around the world, and it's the one we've seen in South Africa, fortunately, is the less infectious, less severe clade. That's the so-called global outbreaks clade. It's clade number 2. There's a different clade which is focused mostly in the Democratic Republic of the Congo, which is clade 1. That seems a bit worse. That's more transmissible and a slightly higher mortality rate. We have not seen any of those cases in South Africa at all. All South African cases have been part of the clade 2, the slightly less severe one, which is whizzing around the world within certain communities.
What makes a disease like this mutate? I mean, again, during COVID, we came to see how you could get new variants really very quickly. And in the end, the virus kind of, I don't know if this is quite scientifically correct, made itself less dangerous. Imagine MPox is a very different kind of thing.
It is, and certainly the idea of viruses changing with time and mutating is very well established. In general, the wider an outbreak, the more opportunity for offshoots to occur into different groups and different strains. So, certainly one of the best ways, to prevent new strains from developing is keeping the total amount of cases down to a low level, which just offers less opportunity. It's whether it gets more or less severe, though, is very difficult to predict. Over the long course of time, most viruses do get a bit less severe, but it's certainly not true in the short term. And we saw in COVID, for example, that although in the end the strains were certainly much less virulent, in the beginning that wasn't necessarily the case. And some of the early offshoots were just as virulent and more infectious and did a lot more damage. So something that has to be monitored closely, I think.
As I understand it, you talk about the pox viruses. One thinks immediately of chicken pox. One thinks of smallpox. Smallpox, of course, a very deadly disease, which is extinct now, thank goodness. I don't think there have been sort of human cases in large numbers in a very long time. Occasionally get the odd wild case. Some people, older people in southern Africa, were vaccinated against smallpox. Some people, many of them, were vaccinated against chicken pox or have had chicken pox or both. Does that give you any protection against MPox?
Yeah, so for chickenpox, no, unfortunately. So chickenpox is actually not a pox virus, even though the name would lead you to suspect. So it's confusing, but it's quite distantly related. It doesn't help really if you've had chickenpox, either vaccine or chickenpox itself. Smallpox vaccination does help. So that smallpox is much closer to MPox in terms of its evolutionary history. And so smallpox vaccination does offer sort of moderate levels of protection. The challenge, of course, is that smallpox vaccination has been phased out for many decades. I believe in South Africa, the last was 1979, if I'm not mistaken, last time people were vaccinated, somewhere around there. And so that immunity naturally wanes with time. And of course, haven't vaccinated people with smallpox vaccines since then. And so that really the amount of protection from that, while it is true, is probably not what you need in the population level. A more effective strategy is to actually get a dedicated MPox vaccine and to give it to those at high risk, not for the general population, but for those who are at high risk of contracting severe disease. That is, I believe, what the National Department of Health intends to do. We don't have vaccine yet, but that is the plan down the line to target specific high-risk groups with a specific MPox vaccine, which will work better than a smallpox vaccine did. But those who did get a smallpox vaccine, they are at some moderate degree of protection from it still, which is nice to know.
In the short term, obviously, this is really about awareness, making sure people are able to diagnose themselves, know when they need to go and get a test or go and see a doctor or go to the hospital. And then, I suppose, also making sure that everyone who needs them gets their antiretroviral drugs and that they're working.
Absolutely. I think those are the two most important things. Exactly right. So if you suspect you have MPox, we really would like people to come forward. Like I said, this is not a highly infectious virus. You're not going to be spreading it by sitting on the bus on the way to your doctor to go and get checked. That's really not how this is spread. So we really want people to come forward, get tested. Those who are tested, the test is very good. It's available both in the private sector and the state sector. And those who test positive, the National Institute of Communicable Diseases will check which strain, which clade it is, to make sure for health purposes and also to assist with tracing any contacts who might have been exposed to help them out too. So if you think if this is something that you think you may have contracted, it really do come forward to your doctors and get tested. And it's like I said, it's a very good, very sensitive test. The negative result pretty much excludes it, which is good to know.
Dr. Jeremy Nel, thank you very much indeed, an expert on infectious diseases, a specialist in infectious diseases at Wits University.